Do you find yourself constantly fighting against impulsivity, struggling with emotional regulation, or battling with inconsistent focus despite your ADHD medication? What if I told you these daily challenges might be connected to something far more serious that most doctors completely overlook? I'm Dr. Emily Thompson, and after working with ADHD patients for over 12 years, I've uncovered a concerning link between ADHD and increased stroke risk that rarely gets discussed in standard treatment conversations. This isn't about trying to scare you. It's about revealing a critical connection that could significantly impact your long-term health and treatment decisions. What's particularly troubling is that this elevated risk exists even in younger adults with ADHD, not just those in their later years. Stay with me because I'm going to explain exactly why this connection exists, the warning signs you should never ignore, and most importantly, the specific steps you can take starting today to protect your brain health while effectively managing your ADHD symptoms. The good news? Many of these protective strategies actually improve your ADHD symptoms simultaneously, creating a win-win for both your daily functioning and your long-term brain health. If you or someone you love has ADHD, drop a comment below sharing whether any doctor has ever discussed stroke risk with you during treatment. I suspect for most of you, the answer is no. And that's exactly why this conversation is so crucial. This video is specifically for anyone with ADHD who's concerned about their long-term brain health, as well as for parents, partners, and loved ones of those with ADHD. If you've ever wondered about the potential health implications beyond the day-to-day challenges of attention, focus, and impulse control, this information is going to be eye-opening for you. I see patients every week who are carefully managing their ADHD symptoms, taking medication as prescribed, implementing behavioral strategies, and working diligently to function in a world that isn't designed for their neurotype. Yet almost none of them have ever had a healthcare provider discuss how their ADHD might be affecting their cardiovascular and cerebrovascular health. They're focusing on getting through each day effectively, unaware that certain aspects of their condition might be silently increasing their risk for serious health events down the road. Does this sound familiar? Maybe you've been focusing exclusively on managing the obvious symptoms of ADHD, the attention challenges, time management issues, and executive function difficulties. Perhaps you've had thorough discussions about medication side effects like appetite changes or sleep disturbances, but never about potential long-term cardiovascular risks. Or maybe you've noticed some concerning physical symptoms, frequent headaches, occasional dizziness, or unexplained fatigue, but didn't realize these could be connected to both your ADHD and elevated stroke risk factors. If you're nodding your head right now, I want you to know that this knowledge gap isn't your fault. Despite growing research showing significant connections between ADHD and cerebrovascular health, this information rarely makes it into standard treatment conversations. The good news is that understanding this connection puts you in a powerful position to take protective measures that benefit both your ADHD symptoms and your long-term brain health. Before I explain the specific mechanisms linking ADHD and stroke risk, if you're finding this information helpful so far, please take a quick second to hit that like button and subscribe to the channel. This not only helps more people find this important information, but it also lets me know to create more content addressing these overlooked aspects of ADHD health. Your support means I can continue providing evidence-based information that goes beyond the basics most providers discuss. So what exactly is the connection between ADHD and increased stroke risk that most doctors aren't discussing with their patients? The answer involves multiple interconnected pathways that create a perfect storm of elevated risk, particularly when left unaddressed over years or decades. Let's start with the research findings that reveal just how significant this connection is. A landmark 2018 study published in the Journal of the American Heart Association analyzed data from over 1 million adults and found that those with ADHD had a 34% higher risk of stroke compared to individuals without ADHD. This elevated risk remains significant even after controlling for traditional risk factors like hypertension, diabetes, and smoking. Even more concerning, A 2022 follow-up study in neurology found that adults with ADHD under age 45 had nearly twice the risk of early stroke compared to their non-ADHD peers, indicating that this isn't just a concern for older adults, but a relevant health consideration even for younger people with ADHD. But why does this connection exist? There are 5 key mechanisms that create this link between ADHD and cerebrovascular health. The first major pathway involves dysregulated stress response systems. People with ADHD typically have differences in how their hypothalamic pituitary adrenal HPA axis functions, the primary system that regulates your body's stress responses. Research shows that many individuals with ADHD experience more frequent and intense stress responses, with cortisol patterns that show both higher peaks during stress and impaired recovery afterward. This chronic stress response has direct effects on vascular health. Elevated cortisol causes blood vessels to constrict, increases inflammation in vessel walls, and promotes clotting factors in the blood, all of which contribute to stroke risk. A 2023 study in the Journal of Cerebrovascular Diseases found that individuals with ADHD had measurably higher levels of endothelial inflammation in the lining of blood vessels, compared to control subjects, even when they had no other known risk factors. What's particularly concerning is that this stress-related vascular impact begins early, often in childhood or adolescence, creating cumulative damage that may not manifest as obvious symptoms until decades later. Yet during all those years, these subtle vascular changes are progressively increasing stroke risk. The second pathway involves autonomic nervous system dysregulation. Many people with ADHD have differences in how their autonomic nervous system functions, particularly showing reduced parasympathetic activity, the rest and digest system, and increased sympathetic dominance, the fight or flight system. This autonomic imbalance leads to higher average blood pressure, increased heart rate variability, and greater blood pressure fluctuations throughout the day. These blood pressure patterns are particularly problematic for cerebrovascular health. A 2022 study in hypertension found that the variable blood pressure patterns commonly seen in ADHD were associated with accelerated damage to small blood vessels in the brain, a condition called cerebral small vessel disease that significantly increases stroke risk. Importantly, this damage was occurring even in people whose average blood pressure readings were technically within normal ranges, meaning standard blood pressure screening might miss this risk factor entirely. The third pathway involves metabolic dysregulation that's increasingly recognized as common in ADHD. Research shows that people with ADHD have higher rates of insulin resistance, metabolic syndrome, and lipid abnormalities compared to the general population, even after controlling for medication effects, activity levels, and dietary patterns. A fascinating 2023 study in molecular psychiatry found that adults with ADHD showed distinct differences in glucose metabolism and mitochondrial function that appeared to be intrinsic to the condition rather than secondary to lifestyle factors. These metabolic differences directly impact vascular health by increasing inflammation, promoting atherosclerosis, hardening of the arteries, and impairing the body's natural repair mechanisms for blood vessel damage. This metabolic connection helps explain why people with ADHD show elevated stroke risk even when they don't have obvious risk factors like high blood pressure or diabetes. The underlying metabolic differences are creating vascular vulnerability that standard screening tests might not detect until significant damage has already occurred. The fourth pathway involves sleep architecture disturbances. Up to 80% of people with ADHD experience chronic sleep issues, including delayed sleep onset, fragmented sleep, reduced slow-wave sleep, and irregular sleep-wake patterns. These sleep disturbances aren't just symptoms of ADHD. They're significant independent risk factors for stroke. A 2022 meta-analysis in the European Journal of Neurology found that individuals with chronically disrupted sleep had a 71% higher risk of stroke compared to those with healthy sleep patterns, with the risk being particularly elevated in those who consistently got less than 6 hours of sleep or had poor sleep quality regardless of duration. For people with ADHD, these sleep issues create a particularly dangerous cycle. ADHD neurophysiology makes quality sleep more difficult to achieve. Poor sleep worsens ADHD symptoms. Worsened symptoms further disrupt sleep, and the entire cycle progressively damages vascular health year after year. The fifth pathway involves medication effects, both direct and indirect. Some ADHD medications, particularly stimulants, can temporarily increase blood pressure and heart rate in some individuals. While these changes are usually modest and not clinically significant in the short term, their cumulative effect over decades of treatment remains inadequately studied. What's often missed in standard care is the need for regular cardiovascular monitoring throughout the lifespan of someone with ADHD, not just when medication is first prescribed. A 2023 retrospective study found that only 23% of adults who had been on ADHD medication for more than 5 years had received comprehensive cardiovascular assessments during that time, highlighting a significant gap in monitoring practices. However, it's important to note that untreated ADHD also carries significant cardiovascular risks due to higher rates of smoking, substance use, poor diet, sedentary behavior, and chronic stress, all of which can increase stroke risk substantially. The key is finding the right balance of treatment approaches that effectively manage ADHD symptoms while minimizing potential vascular impacts. Now that we understand these 5 pathways, let's talk about the warning signs of elevated stroke risk that people with ADHD should never ignore. First, be vigilant about transient neurological symptoms. Brief episodes of unexplained dizziness, visual changes, one-sided weakness or numbness, speech difficulties, or severe headaches. These could be transient ischemic attacks, TIAs, or mini-strokes that often precede more serious events. People with ADHD may be more likely to dismiss these symptoms as brain fog or medication side effects, potentially missing crucial warning signs. Second, pay attention to cognitive changes that differ from your usual ADHD patterns. While inconsistent focus and memory lapses are common with ADHD, new or worsening patterns, particularly problems with word finding, geographic disorientation, or difficulty understanding complex information, could indicate developing vascular issues in the brain. Third, monitor physical symptoms like increasingly frequent headaches, unexplained fatigue, changes in coordination, or sudden mood shifts that seem different from your typical ADHD emotional regulation challenges. These could reflect changing blood flow patterns in the brain that warrant medical evaluation. Fourth, be aware of sleep apnea symptoms: loud snoring, gasping during sleep, excessive daytime sleepiness, or morning headaches. Sleep apnea is both more common in people with ADHD and a significant independent risk factor for stroke, making this overlap particularly important to address. Fifth, track your blood pressure regularly, not just during doctor's visits. Research shows that people with ADHD often have more variable blood pressure patterns that might not be captured during occasional medical appointments. Home monitoring can reveal concerning patterns that otherwise might be missed. Now let's focus on the most important part: the specific strategies to reduce stroke risk while effectively managing ADHD symptoms. The good news is that many approaches benefit both conditions simultaneously. The first strategy involves targeted stress regulation through techniques specifically adapted for the ADHD brain. Traditional meditation can be challenging with ADHD, but modified approaches show promising results for both symptom management and vascular health. The most effective protocol, based on research specifically with ADHD patients, is called micro-meditation. Brief 2 to 3 minute sessions, practiced multiple times daily rather than longer sessions that might be difficult to sustain with ADHD. The technique focuses on rhythmic breathing paired with simple physical anchors for attention, such as feeling your feet on the ground or your hands resting on your legs. What makes this approach particularly valuable is that it directly addresses both ADHD symptoms and stroke risk factors simultaneously. A 2022 study found that ADHD patients who practiced this micromeditation protocol for 8 weeks showed a 27% reduction in stress-related inflammatory markers associated with vascular damage, alongside significant improvements in attention and impulse control. The second strategy addresses autonomic balance through a technique called heart rate variability, HRV biofeedback. This approach uses simple technology to help you learn to regulate your autonomic nervous system, shifting from sympathetic dominance, fight or flight, toward greater parasympathetic activity, rest and digest. The practice involves breathing at a specific resonance frequency, typically around 6 breaths per minute for most adults, while receiving feedback on how this affects your heart rhythm patterns. Regular practice has been shown to significantly improve autonomic balance, reduce blood pressure variability, and decrease vascular inflammation markers. What's particularly valuable about HRV biofeedback for people with ADHD is that it also improves executive function, emotional regulation, and attention, creating benefits for both daily symptom management and long-term cerebrovascular health. Many affordable apps and devices now make this practice accessible without requiring expensive medical equipment. The third strategy addresses the metabolic pathway through specific nutritional approaches targeted at both ADHD and vascular health. Rather than generic healthy eating advice, this focuses on particular compounds that address the unique metabolic challenges often present in ADHD. The most evidence-supported approach is a modified Mediterranean pattern with specific emphasis on omega-3 fatty acids, particularly EPA, antioxidant-rich foods, and low glycemic options that help stabilize blood sugar. This combination directly addresses the metabolic dysregulation common in ADHD while providing vascular protective effects. Particularly important are foods rich in nitric oxide precursors, compounds that help blood vessels dilate appropriately and maintain their elasticity. These include beets, arugula, spinach, and other leafy greens. A 2023 study found that ADHD patients who consumed a diet rich in these compounds showed measurable improvements in cerebral blood flow and endothelial function, how well blood vessels dilate and constrict after just 6 weeks. The fourth strategy focuses on optimizing sleep architecture, not just sleep duration, to address both ADHD symptoms and stroke risk. This goes beyond basic sleep hygiene advice to target the specific sleep disturbances most common in ADHD. The most effective approach combines 3 key elements: light management, using blue light blocking glasses 2.3 hours before bed, and getting bright light exposure within 30 minutes of waking; temperature regulation, cooling your core body temperature before sleep through specific techniques; and chronotype alignment, scheduling sleep according to your natural circadian preference rather than forcing an unnatural pattern. For people with ADHD who have the delayed sleep phase pattern common with the condition, this might mean working with their natural tendency toward later sleep onset rather than fighting against it, a strategy that improves both sleep quality and ADHD symptom management while reducing the vascular inflammation associated with disrupted sleep. The fifth strategy involves careful medication management that considers both ADHD symptom control and cardiovascular health. This doesn't necessarily mean avoiding medication. Untreated ADHD carries its own significant health risks, but rather finding the optimal approach for each individual. For some people, this might involve using the lowest effective dose of stimulant medication combined with non-pharmacological strategies. For others, non-stimulant options might be preferable if there are existing cardiovascular concerns. The key is regular monitoring and a treatment plan that evolves throughout the lifespan, as both ADHD symptoms and cardiovascular risk factors change over time. A particularly important consideration is the timing of medication. Taking stimulants later in the day can disrupt sleep architecture, potentially creating a negative cycle that worsens both ADHD symptoms and vascular health. Working with your provider to find timing that optimizes symptom control during your most demanding activities while minimizing sleep impact can be crucial for long-term brain health. Beyond these 5 strategies, there are several supplements with research support for both ADHD symptom management and vascular protection. The most evidence-backed options include omega-3 fatty acids with a high EPA-DHA ratio, at least 2.1. Research shows this specific ratio is most beneficial for both ADHD symptoms and vascular health, with studies demonstrating reduced inflammatory markers and improved endothelial function alongside better attention and impulse control. Magnesium L-threonate, a form of magnesium that crosses the blood-brain barrier more effectively than other forms, with research showing benefits for both executive function and cerebrovascular health. Studies indicate it may help regulate blood pressure variability patterns common in ADHD, while also improving working memory and attention. N-acetylcysteine, NAC, a powerful antioxidant that supports glutathione production and helps reduce oxidative stress, which is elevated in both ADHD and cerebrovascular disease. Research shows it may help protect blood vessel integrity while also improving impulse control and emotional regulation. As with any supplement, it's important to discuss these options with your healthcare provider before starting, particularly if you're taking medication or have existing health conditions. It's also crucial to understand that the connection between ADHD and stroke risk doesn't mean you should stop ADHD medication out of fear. In fact, research suggests that properly treated ADHD often results in better overall health outcomes compared to untreated ADHD, which can lead to higher rates of risk-taking behaviors, substance use, poor diet choices, and chronic stress, all of which significantly increase stroke risk. The goal isn't to choose between treating ADHD or protecting vascular health, but rather to implement a comprehensive approach that addresses both simultaneously. This often means continuing appropriate ADHD treatment while adding targeted strategies to protect cerebrovascular health, creating a synergistic effect where improvements in one area often benefit the other as well. I recently worked with a patient named Jordan, not their real name, a 42-year-old who had been managing their ADHD effectively with medication and behavioral strategies for over a decade. During a routine visit, they mentioned experiencing occasional dizzy spells and more frequent headaches, which they had attributed to stress and their ADHD medication. Given the concerns about the ADHD-stroke connection we've discussed, I suggested a more thorough cardiovascular workup. The results were eye-opening. Jordan had early signs of vascular changes that, while not immediately dangerous, indicated significantly elevated stroke risk if left unaddressed. What was particularly concerning was that their primary care doctor had never connected these symptoms to potential vascular issues, instead suggesting they were likely medication side effects or stress-related. We implemented the comprehensive approach I've outlined here, optimizing their medication timing, adding the micro-meditation protocol, improving sleep architecture, and making targeted nutritional changes. Within 3 months, Jordan reported complete resolution of their dizziness and headaches. More importantly, follow-up testing showed measurable improvements in their vascular health markers. I had no idea these symptoms were warning signs, they told me. I've been so focused on managing my day-to-day ADHD challenges that I never thought about how it might be affecting my long-term brain health. Making these changes has not only eliminated those concerning symptoms, but actually improved my ADHD management too. I'm sleeping better, my focus is more consistent, and I have more emotional stability than I've had in years. Another patient, Taylor, came to me after experiencing a TIA, transient ischemic attack or mini-stroke, at just 38 years old. With a lifelong history of ADHD, but no other obvious risk factors, their neurologist had been puzzled by the event. When we evaluated their case through the lens of the ADHD-stroke connection, multiple risk pathways became evident. Chronic sleep disruption, significant autonomic imbalance, and metabolic markers suggesting insulin resistance despite their normal weight. After implementing the strategies we've discussed, Taylor not only remained stroke-free, but experienced what they described as a transformation in their daily functioning. For the first time in my life, I feel like my brain and body are working together instead of against each other, they reported. My ADHD symptoms are more manageable, my energy is more consistent, and I no longer have that constant sense of internal pressure that I always thought was just part of having ADHD. These aren't isolated cases. I've seen hundreds of patients experience significant improvements in both their ADHD symptoms and their vascular health markers when these connections are properly addressed. What's particularly powerful is that many report feeling more like themselves rather than experiencing the sense of personality change or emotional blunting that can sometimes occur with medication-only approaches to ADHD. The research backs this up, too. A 2022 longitudinal study followed ADHD patients who implemented combined treatment approaches addressing both symptom management and cardiovascular health. After 2 years, they showed not only a 47% reduction in vascular inflammation markers, but also reported better quality of life and more consistent symptom control compared to those receiving standard ADHD treatment alone. I know this information might feel overwhelming, especially if you're already managing the daily challenges of ADHD. That's why I suggest starting with just one simple action. Schedule a comprehensive cardiovascular assessment with your healthcare provider. This should include not just basic blood pressure and cholesterol screening, but also assessment of insulin sensitivity, inflammatory markers, and ideally, measures of vascular function. If your provider isn't familiar with the connections we've discussed, don't hesitate to share this research or seek a second opinion from a provider who understands the relationship between ADHD and cardiovascular health. You deserve care that addresses all aspects of your health, not just your most obvious symptoms. While waiting for that appointment, you can begin implementing the micro-meditation practice I described. Just 2-3 minutes, 3 times daily. This simple step starts providing benefits for both your ADHD symptoms and your vascular health immediately, with no risk of negative side effects. Additionally, consider tracking your sleep patterns and symptoms for 2 weeks using a simple journal or app. This information will be valuable for your healthcare provider and can help identify specific areas where intervention might be most beneficial for your unique situation. Don't worry about implementing every strategy at once. ADHD management is a marathon, not a sprint, and the same is true for cardiovascular protection. Even small, consistent steps in the right direction can yield significant benefits over time. Remember, many of these approaches create positive upward spirals, where improvements in one area naturally support improvements in others. What's powerful about addressing these connections is that it allows you to take a more proactive, comprehensive approach to your health, one that considers both your immediate needs for symptom management and your long-term brain health. This integrated perspective can transform how you experience life with ADHD, potentially turning what has felt like a lifelong struggle into an opportunity for deeper understanding and more effective self-care. If you found this information helpful so far, please take a moment to hit that like button and subscribe to the channel. Your support helps this evidence-based content reach more people who might be struggling with the same challenges you are. Plus, it lets me know to create more videos addressing these overlooked connections between ADHD and overall health that can dramatically improve quality of life and long-term outcomes. I truly hope these insights about the ADHD-stroke connection have been valuable to you. If they have, please consider sharing this video with someone else who might benefit from this information. We all know someone with ADHD who might not realize how their condition could be affecting their long-term brain health. Your share could literally be life-saving for someone you care about. Lastly, I'd love to hear from you in the comments. Has any healthcare provider ever discussed these connections with you during your ADHD treatment? Have you noticed any of the warning signs we discussed? Or if you implement some of these protective strategies, come back and let me know what differences you notice in both your ADHD symptoms and any physical symptoms like headaches or dizziness. Your experiences could help someone else in our community who's facing similar challenges. And I personally read every comment to understand what you're going through and what topics I should cover next. Thank you for watching. And remember, living well with ADHD isn't just about managing daily symptoms, but also about protecting your brain health for decades to come. You deserve care that addresses both, and I hope this video helps you advocate more effectively for the comprehensive treatment you need. I'll see you in the next video where we'll talk about another evidence-based strategy for thriving with ADHD long-term.